exercise?
Prostate cancer is specifically only found in men.
Oh, okay.
The prostate gland is only found in men, so women don't have a prostate gland.
So it is responsible to produce the fluid that carries the semen with ejaculation, and it also produces, is one of the glands that produces male-specific hormones. Like the testes are responsible for testosterone.
Yeah.
So the prostate is also part of that male component. So no. This one is male-specific, and that's why we're saying boys come to the table.
Yeah. I'm joined in the studio by two people from the Cancer Association of Namibia. Okay, let me slow down a bit, just a tad.
You speak so fast because we're both sitting here in a super rush. The energy is tangible in the studio.
No, it's firstly it comes with being doing a breakfast show, and the amount of coffee that I've had, or that I generally have every morning, because my day starts at 4, and so by 11 o'clock I'm crashing, so I need to. So we are joined in studio by Ralph Hansen, CEO of the Cancer Association of Namibia, and Ainang Nitongo, head of medical at the Cancer Association of Namibia. Now, November is known as the Prostate Cancer Awareness Month. They are here because they are from the Cancer Association, prostate cancer. All right? So to give us information and stuff. Good morning. Thank you so much for joining us. We really, really, really appreciate the time that you guys have taken out to come talk to us and just really educate and give us information regarding what the Cancer Association is and what you guys are doing, but of course, prostate cancer. Now, there's a stereotype. Let's address this one firstly and foremost. Yeah, now, why are men afraid, generally, to go get their prostate checked? Ralph?
I wonder if Stefan's going to allow me saying this on air, but men are afraid of having that finger close to their butt cheeks because the digital rectal examination, the traditional rectal examination, is what scares the living gajebers out of guys.
Yeah.
So I think that is, every time we've said, come for your testing, people are like, no, but I don't want that finger test.
Yeah.
So, I think that is the stigma that is associated with it, and we're going to dispel that myth. It is one of the tests, but we're going to be talking about PSA blood test today. So we're going to introduce our 99FM listeners to a whole new, innovative way of getting tested for prostate cancer, and then we're going to save lives.
Okay, I know. Good morning.
Good morning.
Thank you very much for joining us. So tell us about this new innovative test. What exactly is it, and why is it different from the conventional testing methods?
Well, it's not actually a new.
Right.
It's just a more convenient testing method that will then encourage men to have their prostate checked instead of thinking of the digital rectal examination. So then it was the digital rectal examination, but we've got other tests such as now the prostate specific antigen testing, which is a full blood test done by your doctor, or a nurse can draw the blood, and then the blood is sent into the lab. Then the results will then tell you the PSA level in your blood, which could then be an indication of prostate cancer. So apart from the full blood count, then there is other tests as well, such as the rapid testing, which is also PSA rapid testing, sort of a point of care. But we actually would like to emphasize more on the full blood that a doctor or a nurse can do.
So the thing is with a rapid test, even like we're going through COVID and it's big in the newspapers today about the rapid test, with any rapid test there is a high probability of a false negative. And that is, but as a at least first step into getting men to come to the table, we say, let's do family history, let's look at your own history, let's do the rapid test, and from there we'll motivate and guide you. But the ideal is that men over 45 annually go for a blood test. So it's the same as you would do your diabetes or malaria test. Blood test, drawn some blood, sent into the lab, and then with that full blood test, they can know what the status is.
And I was really looking forward to wearing matching underwear for my exam, but now I can't. No, it's fine. It's just the blood test.
But we can do your rectal examination. It's not a problem. I see the cameras are rolling, so you can bend over and stretch it. I'll hold your hands, and sister can go in. It's not a problem. I think it's very educative for the community. It's a great education tool, and I know that you're a community leader, and the community looks up to you, or they will look down. Or I don't know how the camera angle will be, but it will be very interesting.
I know it's fine. It's fine. I'll put the matching underwear thing on. So, what does the landscape look like in a Namibian context regarding prostate cancer, Ralph? I just to get a sense of what's going on in the country.
So, on average, we have about 3,740 new cancer cases per annum registered in the country. Of that, breast and cervical cancer remains the most prevalent. So women are more affected. 54% of all cancer cases reported in the country are Namibian women. And that's why we place a great emphasis on October and women's health. We don't specifically focus on breast cancer. We say women are important.
Yeah.
And then Movember traditionally is prostate cancer. But we look at the blue and say men are important because prostate is the number third most prevalent form of cancer, number 3 most prevalent form of cancer in the country. And the reality is that between 350 men are diagnosed with this cancer every year. The sad reality about prostate cancer is by the time that men are diagnosed with it, when the signs and symptoms appear, it's generally too late. And that is what makes prostate cancer so difficult.
Right.
Different also from breast and cervical, because you can actually still treat and recover effectively. But with prostate cancer, once those symptoms appear, it's usually too late. And then it comes to those radical surgical procedures where we need to snip and cut and tuck and everything, and then men say, I rather don't want to go for the testing, I rather don't want to know because my manlyhood, my masculinity is affected. Because then you have erectile dysfunction, and then your sperm count is affected, and then you can't reproduce, and then men are saying, oh no, then I'd rather die because I am not going to be
a man, quote unquote.
That's the reality. If I'm not a man in bed, I'm not going to be able to be a man, and then I'll rather die from cancer.
I've taken with November coming, I regularly do the Movember thing, but I don't like shaving my beard.
You look good. You have a good beard. Don't shave it.
Yeah. Yes. So I've decided to do a couple of things. I'm off my socials. No FAP, no WAP. For the month of November, and it's been second week now. Hi. It's rough,
challenging, no?
Yeah, very much so. And then asked me a question earlier when I mentioned that you guys will be coming through. Is prostate also something that for women that can be found in women, or do women? I mean, prostate is, but what I mean is the cancer component of it. Can women also get checked out, or is it just a male specific exercise?
Prostate cancer is specifically only found in men.
Oh, okay.
The prostate gland is only found in men, so women don't have a prostate gland.
So it is responsible to produce the fluid that carries the semen with ejaculation, and it also it's one of the glands that produces male-specific hormones. Like the testes are responsible for testosterone.
Yeah.
So the prostate is also part of that male component. So no. This one is male specific, and that's why we're saying boys come to the table.
Yeah.
I
know okay. So if I'm listening to you guys now, and I'm like, okay, fine, I'm going to come to you. Or do I come to you guys? What are the requirements? How old do I need to be? What do I need to bring with? Just little details. And what is the Cancer Association doing in this particular regard?
Okay, so we're encouraging men older than 40 to have a full blood test done.
Okay.
So that can be done at your doctor or local clinic. You can ask your nurse or doctor to do it.
Sorry, I just want to interject there. I think this is the big thing that we want to emphasize. Go to your local Ministry of Health and Social Services clinic. Tell them they've heard of this interview on 99 FM. And we've heard the Cancer Association team explaining the situation. Do the blood test and tick the form that is at the clinic.
Okay.
It's actually, we've lobbied and we've motivated the Ministry of Health and Social Services to have it on there. So for the last 3 years, the PSA blood count test is on the NIP National Pathology Requisition Form.
Okay.
So if there's a nurse or a doctor or someone who doesn't understand, you say, draw the blood like you would do for blood glucose or malaria or whatever, and just stick right in the middle of that form. There's a part that says PSA.
Yeah.
Tick the box, send it to the lab. This is how we empower Namibians to take health in their own hands, because there are some of the nurses, because this is something that hasn't been around. So we encourage Namibians to take health in their hands, go and get it done, and also motivate the nurses to do it the right way. Sorry, continue.
No, it's okay. So as Rolf said, so
45 and above.
40 years.
40 years.
So
okay.
let's start from 40.
Where am I? Okay.
Yeah. Let's start from 40 years. And then we have younger men that also have a family history that are younger than 40. So if you've got a family history, you also encouraged to go. But at the Cancer Association, what we do the point of care testing, which is the rapid testing.
Okay.
If you then have a history or family history, or you've got signs and symptoms, then we will make a referral for you to the doctor or to the hospital.
Right.
Then the doctors do further examinations now that includes now a full blood test or a pelvic ultrasound to see if the prostate gland has
I want to
enlargement.
get an ultrasound. I'm so excited. So I'm just right.
Yeah.
So from now, will the Cancer Association be having an event or something, or a talk regarding prostate cancer in the next couple of weeks?
So we have got a few events lined up, but the biggest one, fundraiser annually, is our National Golf Day, which is the last Friday of November.
Okay.
So that is a golf day that we're doing in partnership with NAMBOP. And the partnership is unique because when people associate NAMBOP,
it's the irony. I was going to say it.
But it's because they also believe in hope and in life.
Right.
And they are actually our partners with regard to childhood cancers. We have an agreement with them. So vulnerable families where a child passes away, we will do the funeral service through our Chica Fund. The Cancer Association will pay for that childhood cancer patient who has passed on when the family hasn't got the resources. So they are our project partner in that regard. And through this, it's evolved into this, let's create hope, because Cancer Association and NAMBOP are these two organizations that everyone's like, let's just avoid, this is death, this is gloom, this is dull. But it is not. It's about being responsible citizens. It's about saying that there is life, there is hope, and we don't need to just look at the dull and gloom. It's not just the pretty organizations and the fun organizations that get the job done. Us.
Right.
Yeah, the sad
you guys are pretty fun.
We're chirpy as well, as you can see.
Yeah, of course.
We get the job done.
Right.
So the golf day is a huge event. And then throughout the month of November, we have numerous clinics. So every Tuesday, men are welcome to come to our clinic in Windhoek. But what basically happens for the rest of the country is we have the National Cancer Outreach Program, where we travel all across the country in different regions, and we provide free screening as well. So I would like to encourage our listeners next year, as from January, visit our Facebook page and check out when we will be in your town, area, vicinity. Then come out in hordes, massive numbers, and come for this free screening, because we bring the services to you, and then we can save lives.
Let's definitely save lives. Guys, you are big, man. Go get screened. We did give the details. If you have any queries, if you're unsure about anything, please feel free to call the Cancer Association on 061-237-7404. Any detail. And yes, as was mentioned, calm down. They're not gonna do what you think they're gonna do. There's other tests.
Fingering is for politicians, and the fish rod case and all those dramas, as in the newspaper, we don't do those things. No.
Ralph, I know, guys, thank you so much for joining us. We really, really do appreciate the information and the education. I'm actually quite excited. It is unfortunate that I will be now wearing my matching underwear, but c'est la vie. We move. Sounds of Coldplay with BTS. Sorry, BTS. My Universe. Time into is exactly 7 minutes to 9 o'clock. Top of the morning to you. It is Mo and Ann in the morning. Ann, how are you?